So I started this practicing cardiology, interventional cardiology, a world of doing procedures on people to open arteries, put in stents, drill through arteries, abort heart attacks, all that kind of stuff. My mom died of sudden cardiac death about 4 months after her successful two-vessel coronary angioplasty in New Jersey, about 1,000 miles from where I was living. But it drove home, Luke, that trying to manage a dangerous disease like heart disease in a cath lab in a hospital was really an awful way to manage this disease. In other words, many people die at home, or they die en route, sudden cardiac death, or they have a heart attack and it takes a while to get to the hospital. And maybe an hour and a half, 2 hours later, you've destroyed more than half of your heart muscle. So this idea that procedures are the solution is just an awful way to do things. So I set myself a task to find out a way to have people like my mom identified months, years ahead of time so that there was time to take some kind of action. This goes back about 30 years, so it's a long time ago. And the only device that does, the only strategy that does that, and by the way, it's not cholesterol. Cholesterol is a useless, outdated tech. I hate to call it technology because it's so crude, that should have been abandoned decades ago. But as it turns out, it makes so much money for the pharmaceutical industry that they've managed to brainwash all my colleagues and much of the public on the nonsense about saturated fat and cholesterol and good and bad cholesterol, all that nonsense. The real tragedy, Luke, is that the real cause, everybody's focused on statin drugs and reducing cholesterol and fat intake, when the real causes are being ignored. And that's why, even in the US, over 80 million Americans, 80 million take statin cholesterol drugs, and there's been no meaningful reduction in cardiovascular events. The secret, dirty little secret, is the hospital raises $100 million, put on a new cardiovascular wing because heart disease remains, despite all this, the number one moneymaker for hospitals and the healthcare system, and my colleagues, the cardiologists. So there's this kind of silent conspiracy to not know how to put a stop to heart disease risks. So there's a show of let's reduce saturated fat, everything in moderation, statin cholesterol drugs reduce your. It's nonsense. It's garbage.
Mm,
Uh, But there are ways. Anyway, so back then, the only way to identify somebody like my mom at risk would be to do a CT heart scan to measure coronary calcium score. Very simple, very easy to get. In the US, you can get it for about $100. And we measure calcium because you can see it and you can quantify it. Critics say we don't care about hard plaque. Calcium is hard. We want soft plaque. That's a fiction. What the calcium does is quantify total plaque with all its components: soft, hard, in between, fibrous, cellular, etc. It's an index of total plaque. And so we help publish these data. If you have a heart scan score, say, of 400, which is high, normal is zero, well, your risk for heart attack is somewhere in the 6, 7, 8% per year range, high. If you do nothing, that score goes up 25% per year. So a year later, 500. A year later, what, 625. And you're getting closer and closer to dying, having a heart attack, or having the appearance of symptoms that justify such things as angioplasty and bypass surgery. Well, we also help publish these data. If you start at 400 and you take a baby aspirin, a high dose of a statin cholesterol drug like Lipitor, 40 milligrams, follow a low fat diet, exercise program, to this day, my colleagues call that optimal medical therapy. How
mm.
fast does your plaque grow by your calcium score? 25% per year. It has no impact whatsoever. And so throwing optimal medical therapy at you, you've not impacted the progression of the disease. So what do? I set up a heart scan device almost 30 years ago. We called it Milwaukee Heart Scan because I was in Milwaukee at the time, scanning people left and right, thousands of people like you and me who come in and say, you know what? My dad had a heart attack when he was 58. I'm 50. Is the same future ahead for me? You have a scan. Your score is 400 or something like that. And what do? Well, we put you on Lipitor, aspirin, low fat, 500, 625, where you're freaking out. My colleagues, many of whom are sadly unscrupulous, say, look, we'll do the real test, a heart catheterization, or even a CT coronary angiogram, an angiogram on the CT device, and we'll see if you need a preventive stent, bypass, or other procedure. Even though the evidence is clear, that does not benefit, you obtain no benefit, you incur some risk, and the doctor and the hospital make a ton of money when they do these kinds of. We're talking about tens to hundreds of thousands of dollars per patient.
And
So
put the
there's a
patient in
great
debt as well.
financial. Hmm?
And put the patient in debt as well.
Yes, that's right. That's right. So all for no risk. And so what do? I have thousands of people freaking out on me. And the experts didn't know what to do. They actually said this, Luke. They said, "Well, because we don't know how to put a stop to the progression of coronary calcium scores and thereby coronary atherosclerosis, don't repeat the test. Let them have their heart attacks or the appearance of symptoms and then deal with it then." Which, of course, is ridiculous. That was the whole dilemma, right? That we don't want to deal with the disease when symptoms appear or death appears or a heart attack occurs. So it led to a lot of stumbling and trial and error and reasoning. And over the years, I devised an approach. For instance, when you add vitamin D, which is vitamin D deficiency is widespread, it's ubiquitous. When you correct vitamin D, it was the first time, Luke, when I saw heart scan scores plummet, not stop, not just slow down, but drop. A score of 600 could become a score of 400. And you could actually see the shrinkage of both the calcium and the other elements of plaque. You can't see the softer elements crystal clear, but you can still make them out. And you can see that the plaque had shrunk by doing things like vitamin D, a higher intake of omega 3 fatty acids, compensating for the loss of magnesium in drinking water from water filtration with magnesium, addressing iodine. Iodine, I don't think is such an issue in Australia as it is in the US because it's inland areas away from the ocean that have iodine problems. And then, but it became clear, Luke, that that wasn't enough. While we had great success with that very simple formula, oh, and also the diet. The diet is not low in fat. The diet is eat all the fat you want, butter, olive oil. When you buy pork, eat the fat. If you're going to buy ground beef, never lean, make it full fat. So not, but addressing the things that cause the formation of small LDL particles, the real cause for heart disease, not LDL cholesterol, the indirect, crude way to quantify LDL particles. We're going to measure LDL particles, but especially the small LDL particles because they're small, they're better able to infiltrate the walls of arteries. They are more prone to glycation and oxidation. They're more, once they enter the arterial wall, they're more likely to provoke inflammation. And they also last in the bloodstream about a week after you consume something that causes formation, as opposed to 24 hours of a large LDL particle caused by fat consumption. So small LDL, perfectly crafted. And now we have 55 clinical studies telling us that small LDL particles are a dramatically superior predictor of heart disease compared to LDL cholesterol. Why don't people talk about this? Because it makes no money. Small LDL particles respond to diet, period. And simple things like vitamin D and omega 3 fatty acids. So someone starts, say, somebody has a heart scan score that's high, or they had a history of a heart attack or bypass surgery. We do their lipoproteins, called lipoprotein analysis. And they start at maybe 2,400 nanomoles per liter, particle count per volume. We eliminate the causes, and the causes are very easy: wheat, grains, and sugar. The foods
Mm.
the government tells us to eat more of, the foods that the American Heart Association, American Diabetes Association, the Academy of Nutrition and Dietetics, all these agents all tell us eat more healthy whole grains that contain the carbohydrate amylopectin A that provokes formation of small LDL particles. Not my speculation, Luke. This is well sorted out. So we eliminate wheat, grains, and sugars. Small LDL drops from 2,400 or something like that, typically to zero or other low number. It's not 10% better. It's not 30. It's eradicated more often than not. Uh, and that's when we started seeing people regress or even reverse their heart disease. But it also became clear that we had to pay attention to the microbiome. And as it turns out now, the microbiome plays a big role, not just in heart disease, but in virtually all common chronic diseases, from obesity to type 2 diabetes to autoimmune conditions like rheumatoid arthritis to cognitive impairment and dementia, Parkinson's disease, skin rashes like rosacea, psoriasis and seborrhea and eczema, to emotional and mental health issues like depression and anxiety. So, in other words, that had became a huge issue. But the good news, Luke, is that it gave us even greater control over your health, your future, and and by the way, your body shape and appearance.
Thanks for watching this clip of the Getting Mental podcast. If you like this clip, check out the full episode here or more clips here.